Digestive issues are something many can relate to, at least some of the time. They're unpleasant, and we don't often talk about our symptoms due to fear and embarrassment.
But what if that stomach ache isn't just a stomach ache? Dr. Phillip Hart joins us now. Hi, Dr. Hart.
Hi, Sasha and Ebony. Thanks for having me on the show.
Tell us, what are some common GI issues and symptoms that many people face?
So these symptoms that we're talking about today, digestive symptoms, are incredibly common and affect about 60 to 70 million people in the United States. And there's really a pretty wide spectrum of these types of symptoms, which include things like abdominal bloating, gas, and change in the stool pattern.
And why are people hesitant to share this information with their healthcare professional?
Yeah, so we recently completed a survey that was called EPI Uncovered. This was supported by the American Gastroenterological Association. One of the most startling findings from our survey was that on average, patients waited 4 years before discussing their GI symptoms with their healthcare provider. And of those patients that had a difficult time with this conversation, 60% cited embarrassment as the primary reason for waiting to discuss their symptoms.
What is EPI and why is it often hard to diagnose?
EPI refers to or stands for exocrine pancreatic insufficiency, and this is a condition that happens when the pancreas doesn't make enough enzymes to help us digest food properly. The symptoms that can happen in people that have EPI in its most severe forms would be things like greasy stools or unexplained weight loss. But in milder cases, these symptoms can be things like abdominal bloating or gas.
How can patients take a more proactive role in their digestive health?
Again, as highlighted by the fact that patients on average waited 4 years to start the conversation, we want to encourage patients to take a more proactive role in first just discussing these symptoms with their healthcare providers. And it's only after the symptoms are discussed in an open environment that their healthcare providers can help them understand whether or not these symptoms might be due to a reversible or treatable condition such as EPI.
Where can we find more information?
To get more information, they can visit either identifyepi.com or gastro.org.
Dr. Phillip Hart, it's been a pleasure having you here on Coffee with America.
Thanks again.